Okay, we're going to start chapter 7 and part of chapter 8 today, abdomen and pelvis. I purposely named this part of the lecture or this series of lectures CT of abdomen and pelvis because I'm trying to just concentrate on the structures and their functions today. Next time when we meet, we will be talking about more MRI and what they look like. What would those structures look like in MRI and some of the CT images. So just to get you guys going and kind of do a knowledge check. A, B, C, D, I marked those and you all said in class as well. A is liver, B is the spleen, C is the left kidney, and D is abdominal aorta. So this next one, these are the structures that we're going to be talking about. We'll talk about liver, stomach, spleen, gallbladder, small intestine, large intestine. We'll talk about some of the muscles of the abdomen as well as some of the muscles of the pelvis, although I won't go into too much detail with them. But these are the structures we'll talk about. We'll also talk about their functions, what they do, especially liver and pancreas. We'll go a little bit more into details with them. We'll talk about adrenal glands, kidneys, and so on and so forth. So this is another scan. This is actually MRI, but it shows those structures so well that I wanted you to see it, how it shows liver. It, on the right side here, it's showing the spleen on the left side, showing the aorta and IVC both on the left and the right, respectively. Next one, we're going to talk about liver, which is a large and a complex organ. It's the largest abdominal structures in the body. You can divide it into two lobes, the smaller left lobe and the bigger right lobe. What divides them is called falciform ligament, and falciform ligament not only divides the liver into two lobes, it also anchors the liver to the abdominal wall. And I mentioned this before as well. Abdominal organs can't just be hanging without being anchored somewhere to the abdominal wall. So that's what those ligaments would do structurally. There are some other ligaments in the liver as well, but we're not going to concentrate on those. My main point is for you to know left lobe and the right lobe and what falciform ligament does. This is an image looking at the looking at the liver posteriorly. You're looking at, obviously, the right lobe is here, the left lobe is here. We are also looking at hilum of the liver, which is this area where all the vessels and arteries and veins and nerves enter liver, and it's called porta hepatis. So hilum is an opening. We had a hilum for the chest, now we have hilum for liver, and this specific hilum is called porta hepatis. Also on this image, you can look at the caudate lobe, which is a smaller, again, lobe posteriorly. And there's also quadrate lobe, which is inferior to the liver, but we can't really see it in this image. We will be able to see it on some of the CT images later on. Okay. And just to start with the vessels of the liver, obviously you'll see the hepatic artery here, which is the artery that feeds liver. It has oxygenated blood, so for the liver to live, we'll also have hepatic veins that go from the top, or from superiorly to the liver, and then we'll have a portal vein that's very important as well. And we'll talk about portal vein extensively in just a second. The next one is the same image that you saw before, but it's good because it's showing the left lobe of the liver, and it also shows falciform ligament a little bit better. Next one is same image, CT of the same area, looking at the left lobe of the liver and also falciform ligament right there. Caudate nucleus, caudate lobe of the liver is also shown here. And I believe maybe next one will show us the quadrate lobe. And I think I asked you in the class 2, what is this structure with the white in it, and you all said it is stomach with barium in it. So next one is an MRI scan, axial scan of liver again. This one shows caudate lobe and quadrate lobe both. It is a little bit more inferior, but it shows the stomach here as well. So what are the functions of liver? Some of the main, it has a lot more functions that I've mentioned here, but I sort of wanted to list the most important ones. Production of bile, conversion of excess glucose to glycogen, storage of vitamin B, iron, and copper, production of certain proteins for blood, and also one of the most important thing is clearing of the blood of drugs and other poisonous substances. So these are functions of liver. This one shows the vasculature of liver pretty good, and I like it because it shows obviously the portal vein here, the hepatic artery here, and also the veins that are going, the hepatic veins that are on the superior portion. It also shows gallbladder, which is on kind of tucked in underneath liver, and also falciform ligament, which is dividing the left and right lobe of liver. Speaking of the arteries and vessels, you're looking at the abdominal aorta coming down, and it branches off. We've always said aorta comes down and it starts branching off to different structures to feed them. So this is one of them. One of the main first branches of aorta is celiac trunk. And celiac trunk divides into 3 branches: the left gastric artery, the splenic artery, and then common hepatic artery, which is this one. So each of those, based on their names, take the nutrient blood to those areas, those structures. We just looked at hepatic artery, so this is the common hepatic artery that goes towards liver, and it feeds oxygenated blood to liver and helps it live. The other branch that's important is superior mesenteric artery, and superior mesenteric artery is the second branch that comes off of aorta. It's important because it's the artery that feeds part of the other structures, for example, some part of the pancreas and other structures of the abdomen. This picture is also good because it shows the relationship between all of these structures and where they're located. Okay, let's go to next. So next we're going to talk about the stomach. This shows how the left gastric artery comes around the stomach and kind of feeds it. It is a structure sort of on the left side of the body. Spleen is to the left of the stomach. We want to make sure we know the different parts of stomach, which is, I know, a review for you guys. The fundus of the stomach is on the top. Then there's the body, and then pyloric antrum, and then pyloric canal, which basically the food goes through that pyloric canal and the sphincter to the duodenum and the rest of the small bowel. In the inside of the wall of the stomach, we have rugae, which are the the creases, or the I don't know what they call it in your book. These are the folds or creases that basically are in the internal surface of the stomach, and they are there to increase the the capacity of the stomach, sort of. Pyloric orifice and the duodenal bulb, and then duodenum also shown there. So this is a CT showing the fundus of the stomach and some barium inside the stomach. Next one again is CT. It's showing it a little bit more inferior, the scan showing the air, and then pyloric sphincter, and then part of the duodenum is also shown. This one shows gallbladder a little bit better, which that's the next one we're going to talk about, and the vessels that are feeding these structures. We've seen left hepatic artery before, which is this one. Portal vein is right behind it. Common hepatic artery, which is coming from the celiac trunk, way over here, right? And then the gastric artery, and then duodenum here. Same vasculature shown in CTA, showing how the aorta divides into those different branches. Next one, this is an MRI that shows the same thing, a common hepatic artery, celiac axis, and the splenic artery going to those structures. This one also, now looking at the portal vein, IVC aorta, and sort of in that area where vessels are going in. This one shows portal vein, inferior vena cava, and splenic vein really well. Portal vein is really important. You need to know where it is. It shows up in a lot of the CT and MR scans, so it's really important for you to recognize portal vein. Again, just the vasculature of the liver, this time veins, and the hepatic veins divide into the left, middle, and the right hepatic veins, so which they all feed into the inferior vena cava, and then it goes to the heart to be oxygenated. Heart and the lungs, obviously, to be oxygenated. This one again shows the vasculature, the gallbladder. So gallbladder really acts as a sac, a reservoir for bile. It always has some fluid content, so it has a cystic appearance in CT scans, which you've seen so far. It's kind of oblique and inferior to the liver. It is attached to the rest of the basically the GI system via a cystic duct. So if you look at the cystic duct here, it goes from the gallbladder to the common bile duct. What happens is that via the common bile duct, all these bile and enzymes go into duodenum in order to help with the digestion. And later on we'll talk about pancreatic duct as well. Okay, so let's do some questions. The internal surface of the stomach is covered with multiple folds. These are the crease or folds. Increases the surface area of the organ. What are these folds called? And you all said gastric rugae, and you're all correct. Next one, this is the vessel that supplies nutrient-rich blood from the gastrointestinal tract and spleen to the liver, and that is the portal vein. And I think I may not have mentioned it when I just recorded, but you all know that portal vein is one of the most important vessels in liver, and because one of the functions of the liver is to clean the blood out of the drugs and poisonous material, something has to do that. So when you take drugs, when you take ingest any kind of alcohol or poisonous material, it goes to your stomach and to your GI system. That there has to be a connection between the GI system and liver, and portal vein is what makes that connection. Portal vein takes all that nutrient blood from the GI system to liver to be cleaned out. And that's the uniqueness of liver, having both hepatic vein, hepatic artery, and portal vein. So that's important to know. So the following are all functions of liver except which one? And you all said production of calcium for bone strength. That is not what liver does. So C is the correct answer here. For some reason, these next two, not the next, this one as well, did not show up on Explain Everything. And this is the slide that you have it on your PowerPoint. It's where I was showing you a metastases of the liver, and they were spots on the liver on two different patients. The spots were looking really dark spots with the light spots in the middle of them, and that's slide 27 on your PowerPoint. And then slide 28, I'm not sure why it didn't show up. That was the one that was showing the cystic duct and the pancreatic duct and the common hepatic duct coming together to form the common bile duct and going to the duodenum. That one, for some reason, did not show up. But it's okay because we have it here kind of as well. You have the cystic duct, and then you have common hepatic duct. They turn into common bile duct here. And then pancreatic duct connects with them, kind of joins them here into ampulla of water. And then this is where the beginning of duodenum and sphincter of Oddi is. The beginning of duodenum, where all the bile and all the enzymes go in to help digestion of the food. Same thing, showing in kind of a cartoon of the same thing we just talked about. This one's really good because next we were going to talk about spleen, which is located on the posterior left side. It's in a way behind the stomach, and it's visualized. You can see spleen with or without contrast, and you've seen it on CTs, the ones that you see in clinical, and also the ones that we've been seeing together. Pancreas, if we want to start talking about the pancreas, that's important. It's a very important structure that goes from the left side to the right side of the body. One of the main things you want to know about pancreas is that the tail of the pancreas, which is on the left side, is the most superior portion of the pancreas. Therefore, when you're doing your CT abdomens, the tail of the pancreas would be the first thing you'll see. There is less vessels around the tail. Obviously, there are a lot more vessels on the head and neck area of the pancreas, and that's why it makes it so difficult. If there is a tumor of the head and neck, it's very difficult to do surgery on that part, and unfortunately most of the cancer of the pancreas that end up being on the head and the neck, they have a poor prognosis, and the patient usually dies within a couple of years. Okay, let's go into this is a slide that shows some of the things that we were talking about. Spleen is shown here, the kidneys are here, superior mesenteric artery, very important to know. And then actually part of the pancreas is shown here too. Let's bring it up. Part of the pancreas is shown right here. I told you superior mesenteric artery. This is the vein actually. Superior mesenteric vein and artery are very important. I'm not going to ask you to differentiate between the artery and the vein, but I will ask you to tell me where the artery is. And I said before, it's most of the time behind or in the back of the pancreas. That's where it's coming out of the aorta. and it's sort of posterior to the pancreas, superior mesenteric artery. So that's really important to know. Here's another one that shows the pancreas really well with the tail of the pancreas and the rest of the structures we've been talking about. Again, superior mesenteric artery showed up here. What does pancreas do for us? Well, two things. It produces chemicals that neutralize the stomach acids. That's why we have the pancreatic duct that joins the common bile duct and goes into the duodenum. Number two is another very important job of pancreas is regulation of the blood sugar through islets of Langerhans, which are the cells that secrete two things, glucagon and insulin. Glucagon is a hormone that raises the level of glucose in the blood, and insulin stimulates the cell to use glucose. Therefore, it decreases the amount of glucose in the blood. So glucagon and insulin work the opposite way. And and your body works that way too. Whenever the glucose levels go up, insulin gets secreted in the body so we can get rid of that glucose. Whenever glucose levels in the blood goes down, glucagon gets secreted from the pancreas. So in both ways, pancreas has to work properly in order to do that for the body. And you've probably heard of the negative feedback that works in the body, and that's what it is. It's the negative feedback. Wherever something goes up, another hormone comes to lower it down. Whenever something goes down, a hormone comes to bring that substance or the product up in the body. So that's what pancreas does in body. There's a lot of systems in the body that works with this negative feedback function. So, which duct attaches the gallbladder to the rest of the biliary system? And that's cystic duct. That's the duct that directly attaches to gallbladder. Next one, I showed you this image of the pancreas and the stomach and the colon shown here, but the pancreas is not normal. This is pancreatitis. This is inflammation of the pancreas. And unfortunately, when something like this happens, the tissue, the actual pancreatic tissue starts attacking itself. And when chronic pancreatitis continues in a patient, they start losing the cells and pancreas starts to die. And that's where the patient starts becoming diabetic and they have to inject insulin and so on and so forth. So this is something that we need to recognize. If we see it something like this on a CT, it's a sign of alert for us. This one you've seen again, just showing again pancreas with the location of the rest of the structures in the abdomen. You saw this one as well, just to repeat, just to make sure we all know where everything is. So let's do some more knowledge check here. I had you guys write these on a piece of paper to make sure you all knew which structure, every structure was, and I think you guys already have the answers. We don't have to go through them. And plus the next slide shows all of them, all of those structures again, which is this slide showing all of the structures. Okay. This next slide, we're going to be talking about adrenal glands and then the kidneys, which are very important. Adrenal glands sort of look pyramid shaped. They're on both kidneys, right and left. Adrenal glands are important because they also secrete certain hormones that are very important for our body. So let's go to next slide. These are the shapes of the adrenal glands that you would see on CTs and MRs. Sometimes they look like a hook. Sometimes they look like a tent like that. The different I think we're going to see one of these shapes later on in one of the CT scans. So what do adrenal glands do? Two things. The cortex of the adrenal gland, which if you look at an adrenal gland, let's say it looks like this, right? So the top portion or the outermost layer is the cortex of the adrenal gland, and in the middle is medulla. So the cortex produces cortisol and other hormones to control body's carbohydrates and also affects the immune system. The medulla produces epinephrine, which increases the heart rate and it increases the blood flow to the muscles and the brain. That's your fight or flight hormone, right? So whenever you need to run, epinephrine gets secreted in the body to help with your in the muscles and gets blood to the muscles that you're able to run. Let's see, what else do I want to tell you about the adrenal? So this is the location of adrenal glands if you were looking at them on a in a coronal MRI image. This is what they would look like. So this is the right adrenal gland close to the IVC on top of the right kidney, and this is what it looks like. So the right adrenal gland is, I'm not going to put any color on it because you won't be able to see it. So right adrenal gland is right there, it shows. And here's the left adrenal gland on top of the left kidney next to aorta, which is shown here. So the left adrenal gland looking at that. Let's talk about kidneys next, which are behind the peritoneum. We'll talk about the peritoneal cavities and retroperitoneal cavities extensively next time. But for now, there's the hilum of the kidney and there's pelvis, which is this picture next. There's also renal cortex. So basically the production of urine starts from the in the renal cortex, and nephrons are the functional units of the kidney. So as you can see, renal cortex is here and renal medulla is here. The production of urine starts in the renal cortex with the Bowman's capsule, which has a very, very small, tiny, microscopic arteries that are, and the Bowman's capsule. That's where the interaction happens with the Bowman's capsule, and all the toxins are taken away as urine from the Bowman's capsule into the loop of Henle, descending and ascending loop of Henle, and that's where urine production happens in the cortex, and then delivery of the urine happens in the renal medulla. But the main, again, interaction happens between the loop of Henle and Bowman's capsule, where all the nutrients and everything that we need and the water stays in the bloodstream, and all the toxins are taken away by Bowman's capsule and then the loop of Henle to go to the collecting duct and then go into the ureters in order to go to the bladder. So after urine is produced, it goes to the renal pelvis and it goes to the ureter this way to go to the bladder. This one shows a CTA where once we inject contrast, an IV contrast, it shows up, it brightens up the pelvis, the renal pelvis, and then it shows up coming down. And showing here the axial image of the right ureters and the left ureter brighten up. They look like little dots. Here shows a CTA that again shows the urine going down into the bladder, which is a reservoir for urine, and then gets secreted from the urethra out of the body. Here we're looking at an MRI with here the left kidney is shown and the pancreas and the stomach and liver, which we've seen before. This one shows body of the pancreas. Greater and lesser curvature we'll talk about next time when we talk about more in MRI and what the stomach and the intestines would look like. Next we'll do large and small intestine. Small intestine is located in the basically inside, internally inside the body, and then large intestine is more peripheral. That's what I mean by inside body. Everything is inside body, but basically when you're looking at an axial, which we'll look at again, looking at an axial image, all the small intestine is more internally located. Large intestine is peripheral, outside of the area. So these are all different images that enable us to see mostly the small intestine because there's contrast in it, and you'll see it inside. Axials will show the large intestine being more peripheral, and that's what I mean. So small intestine is here in this area, large intestine is outside peripheral. I'm going to erase those because I don't want you to not be able to see the image. Okay, next. So again, looking at an MRI, and this one shows it really well, where you're looking at the transverse colon right here, and then you're looking at the more of the small intestine here. Same thing, transverse colon. Now we're low enough that we'll mostly see just the large intestine. All right, I think we're getting into, yes. So anteriorly, in the anterior portion of the abdomen, you have certain muscles. And those are rectus abdominis muscles, or your six packs. Between the two rectus abdominis muscles, you have linea alba, which is a tendinous structure that connects them together. Also, on the lateral side, you will have muscles, which is the external oblique, transverse abdominis, and internal oblique. And those are image. On this image, it shows a lot better. You have the external oblique, you have internal oblique, and you have transverse abdominis muscle, which are all shown here. So you have rectus abdominis anteriorly, you have linea alba that divides the two rectus abdominis on two sides, and then laterally and sort of oblique in the abdomen, you have the three oblique muscles. Let's talk about general pelvic anatomy just a little bit. So we talked a little bit about the female pelvis and the male pelvis and how you can recognize them. Yes, the female pelvis is wider, male pelvis is narrower, but you also need to know some of the muscles, important muscles of the pelvis. The gluteus muscles, minimus, medius, and maximus, are very important. Those are the three muscles of the buttocks. They're posterior to the iliac wing. You have the iliacus and iliopsoas muscles. Those are the fan-shaped muscles from the iliac crest and also on the posterior pelvic cavity. And then erector spinae is another massive muscles that are on the two sides of the vertebral column. They're they're like prominent bulges on each side of the vertebral column. And some of the images on in your book will show those. So those are the three groups of muscles in the pelvis that you need to know. I know I may not have mentioned them too much in the lecture, in the face-to-face lecture we had, but I think they are on your outline. So the three muscles, the gluteus groups of muscle, iliacus and iliopsoas muscles, and erector spinae. Those are the three main muscles. So this one shows the gluteus muscles well. This is an MRI of the pelvis. I think we talked about the bifurcation. I want to talk about the rest of what happens to the aorta after it bifurcates here in the abdomen, then it comes down to bifurcate at the level of L4. It bifurcates into the right and left common iliac arteries. And then these common iliac arteries, in turn, they bifurcate when they come down. So the internal iliac artery goes into the pelvic area, and then the external iliac artery descends along the medial border of the psoas muscles, and then it turns into femoral artery as it goes down. This is showing the same image of the aorta coming down and bifurcating. This is a CTA, and I think we were just looking at the renal arteries and on the left and right side, and I asked you whether you think which renal artery would be longer, and you all said the right renal artery would be longer because the distance from aorta to the right kidney would be more, because the aorta is more to the left side of the body. Next one shows the same. It's basically looking at the right external and internal iliac arteries, and also the darker vein or the darker vessel here is the vein, the external iliac vein that actually attaches or joins the inferior vena cava there. Let's talk about the female and male pelvis just a little bit and how they would look like on a CT or MR images. So basically on both pelvises, both male and female, you'll see the rectum posteriorly, then you'll see the bladder anteriorly. What's in the middle there, that's the difference between the male and female. And looked at some of them. For example, this is a female pelvis. You're looking at the bladder anteriorly, vagina in the middle, and then rectum posteriorly. This is in the middle as well. And I think we have a better image of it on an MRI, a sagittal image of the uterus, where it looks really homogeneous in the muscle of the uterus, where inside of it looks lighter because there's fluid inside of the uterus. Let's get rid of my coloring. And then obviously the rectum is posterior, vagina and the uterus are kind of in the same area. Urethra goes down here for the urine to come out. Bladder on a T2 weighted image looks white because it's fluid, and fluid looks white on a T2 weighted image. Here's an axial view of the female pelvis where you're looking at the bladder anteriorly, then you're looking at the uterus, and then rectum posteriorly. And male anatomy, which looks something like this, with the seminal vesicles that look like a triangle posterior to the bladder, and then you have the rectum more posteriorly to those. And I think that was our last slide, so I hope this helped. I'm going to post this on Moodle for everybody, and hopefully everybody can review the slides and review the lecture, and let me know if you have any questions. Okay? Thank you, and have a great weekend.